Hello, everyone. Good afternoon. I am Dr. Shayla Toombs Withers, family physician here at Essence of Health Wellness Clinic. Thank you for joining me this afternoon. So, June is Pride Month for the LGBTQ community. And Pride is a celebration of everyone having the freedom to be themselves and to love whomever they choose to love unapologetically. Pride Month was started to pay homage to the Stonewall Uprising in June 1969 in New York City, which helped to spark the gay rights movement and help with gay rights and equality to get to where we are today. Those individuals who identify as lesbian, gay, bisexual, transgender, queer, LGBTQ is the acronym that we use, can suffer from many of the same health issues as those who do not identify as this group. However, LGBTQ individuals may also have some unique health needs that they or their healthcare provider may not be aware of. So I wanted to help celebrate this wonderful group of people just by aiming them with knowledge to help them maintain good health. So just for ease of discussion today, I will be breaking this chat up into three groupings, gay, lesbian, and then transgender. So the first important point that I really wanted to bring home is that those individuals who identify as this group, as anyone in this group, just to inform your healthcare provider. That part is so important. That you do inform your healthcare provider with with how you identify sexually, because that plays an important part in their ability to take good care of you and to provide you with appropriate care according to your needs. So that's my first tip, is just be aware, make your provider aware of how you identify. Now I'm going to start talking with about gay men in that category. Now, first of all, for all men, regardless of your sexual orientation, heart disease and cancer are the leading causes of death. According to information from the Centers for Disease Control and Prevention, the CDC, gay, bisexual, and other men who have sex with men are at increased risk of human immunodeficiency virus, HIV, and sexually transmitted infection with hepatitis. So, one way to reduce this risk of HIV beyond the practice of safe sex is through pre-exposure prophylaxis, or PrEP. PrEP is a daily medication that you can take to help prevent HIV infection. It has been shown to be highly effective in reducing the risk of HIV when taken daily as prescribed. In terms of reducing the risk of hepatitis, make sure that you have been vaccinated for both hepatitis A and hepatitis B, because these vaccinations are widely available. But also be aware that there is no vaccine available for hepatitis C. However, it is now a very treatable condition with current medication therapy and proper management for hepatitis C. The next thing I wanted to speak about with gay men is human papilloma virus, or HPV. It's another sexually transmitted virus that can increase the risk of anal cancer and esophageal cancer in this particular group of individuals. This virus is also responsible for genital warts. HPV is now routinely tested in women, but it's not routinely tested in men, so be aware of that. However, there is now a vaccine to help prevent those highest risk strains of HPV, and that vaccine is actually indicated for both women and for men to receive this vaccine. Keep in mind that the vaccine won't cure previous HIV infection, but it is very effective at preventing future high-risk HPV strains that you may come into contact with. Beyond sexually transmitted infections, gay men are also at increased risk for mood disorders and substance use. A variety of factors may play a part into this risk, including the chronic high stress that these individuals are unfortunately under from social stigma that this group is often subjected to, as well as intimate partner violence. There are culturally sensitive mental health resources available. Some of these places that provide this is NAMI, which is the National Alliance on Mental Illness. There's the LGBT National Help Center also. Beyond these resources, some great ways to help with coping is through finding a community which you can relate to and identify with, attending some of the National Pride Month activities to help encourage and support you, and to certainly engage your healthcare provider for help if you are tending to suffer from mental illness. The next category of individuals I want to talk to are lesbian women. So, as with men, heart disease is the number one killer of all women. These are facts just in America for all groups of people. Lesbian women also are at an increased risk of breast cancer. Now, this particular risk is related to the fact that lesbian women are less likely to have had a full-term pregnancy, and hormones released during pregnancy and breastfeeding can offer some protection from breast cancer. As with men, human papillomavirus or HPV is also an important risk factor and contributor to cancer in women, and particularly for women, cervical cancer. All women aged 21 to 65 should have routine pap smears as screening for cervical cancer. And as we previously discussed with men, the HPV vaccine is also recommended for women, and it can be helpful in the prevention of cervical cancer in women. Some studies have also shown that lesbian women are less likely to get routine pap smears and mammogram screenings, which is important to help in early recognition and prevention of these particular cancers. This can also be due to a variety of reasons, including fear of discrimination, fear of what that examination may entail within itself, lack of health insurance, amongst many other reasons. But I did want lesbian women to know that there are resources available to you to help you obtain these much needed screenings. My next group is transgender individuals. And so another just important PSA I wanted to make these individuals aware of is just to make your healthcare provider aware of how you identify. And be sure to include how you identify in terms of gender identity, but as well as your sexual orientation and how you identify sexually, so that your healthcare provider has the most information to provide you with the most appropriate medical care. Discussing hormone therapy with your doctor before using certain treatments is very important within this group. I don't advise individuals to use things that may not have been prescribed by their doctor, because they may miss certain important risks or things that they may develop from use of hormones without the guidance of your healthcare provider or your doctor. Depending upon the hormone, you may be at increased risk of blood clots, blood pressure issues, blood sugar issues, and or certain forms of cancer. Access to appropriate care, once again, that mental health support and support, including support with tobacco cessation and substance use, is also very important for this group of individuals. For depression, tobacco use leading to chronic disease and increased risk of chronic stress relating to social stigma, increased risk of being a victim of violence and discrimination greatly affects this group of individuals. So at Essence of Health Wellness Clinic, I strive to make all individuals feel included and supported. As you celebrate Pride Month this month of June, remember to have a visit with your doctor to help you maintain good health, to celebrate love and your unique individuality for many years to come. The essence of health is in you. Again, I am Dr. Shayla Toombs Withers. Thank you for joining me today. I am accepting new patients. You can learn more about Essence of Health Wellness Clinic at www.essenceofhealthwellnessclinic.com. You can also follow me on Instagram at Essence of Health Wellness Clinic, and you can follow and subscribe to my YouTube channel, where you can find this video and many other videos also at Essence of Health Wellness Clinic. And I will list some important resources that I just wanted to continue to share with our group of LGBTQ individuals that may be helpful to you and to share with others. I am going to take a look here to see if there are any particular questions that I can answer while we're live. Thank you all for joining me today. Let me see. Khadijah, I should never get breast cancer. Well, Khadijah, as a woman, we all have a certain amount of risk that we can develop breast cancer. So, mammogram screening is important, as well as discussing those risks, particularly with your doctor. If you have certain things like a family history of breast cancer, or you may have not had children, or there are, many other risk factors that can play a part into breast cancer. If anyone has any further questions, feel free to leave them in the comment section and I will respond to them and offer any kind of assistance that I may be able to provide. So I hope everyone has a good weekend and a happy Pride Month. Take care. Thank you.